I do want to welcome everyone. Good afternoon. Thank you for joining us for our first ever community meeting. Jim Nellis, who's the board chair, would normally give this address, but as you can see, this is the new normal. Little technical glitch on Jim's end. Hopefully we get that fixed. You can hop back in and I can remove myself as your understudy. I do thank you, Jim, for your leadership at the board, and I can't come close to imitating you in this position. So I'll try my best. I'm going to start with a territorial acknowledgement. So we are acknowledging that the land that we are meeting is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. On the line, I can see we have 164 participants. That's by far the largest number of people that have joined us for this first ever meeting. Previously, we would have our annual general meeting in our multi-purpose room with a maximum of 50 people, largely our boards from the foundation and the health center boards. But today we have families, so welcome families, donors, volunteers, staff. Hi staff, hope all is well if you're watching this later. I know you're working hard today. We also have government, members of our stakeholder community, partner organizations, and of course, our boards of the health center, as well as the foundation. So over the next 45 minutes, we're gonna fly through many milestones in Kensington's journey this year. We have some amazing videos and montages that we want to share. And there'll be moments where it will be quite emotional. We do have a family member here, Judy Searle. Her husband died at the Gardens due to COVID-19 related complications in April. And I know it is so courageous of you, Judy, to come forward today and or record a video for us, and hopefully you get to see the final product today. And so thank you for doing that, much appreciated. Then also we're gonna hear from a different perspective from a staff member, Ana Celayeta, a personal care attendant in the North Building of the Gardens, and she will give her perspective of what it was like at the front line during the pandemic. And having worked side by side with you, Anna, you are a powerhouse. You are extraordinary. You and your colleagues showed me how deeply committed you all are to serve the residents, not just on 1 East, but throughout the Gardens during this challenging time. I'll also give some remarks around some key areas of focus. So there's been ongoing work despite the pandemic that I want to share with you. And you probably noticed that new visual identity. So I'll also talk a little bit about our rebranding. And lastly, we'll hear a couple remarks from our CEO of the Kensington Health Foundation, Corinne Rustrutz, and we'll close off from there. So it is busy. We got lots to cover, and but before I do, I just want to acknowledge a couple of board members who have amassed more than 120 years of service combined. They are rolling off the board. We did amalgamate last year. And so we had a large number of board members, and these board members chose to roll off. So I do want to thank the following for their invaluable contributions, their insight, their wisdom, their friendship, and their guidance. So Douglas Anderson, and he served 13 years on the Kensington Health Board. We're not losing Douglas because he is also on the, he currently serves on the Kensington Health Foundation Board. Sunny Boot was with the board for 3 years. A big thank you to Carmen Di Puella, who has served on a number of Kensington boards for over 30 years. In fact, Carmen was part of the Doctors Hospital Board before we became Kensington Health. Another long-term board member, Robert Hall, Also had his tenure at the Doctors Hospital Foundation Board starting in 1985. So that's 35 years of service. Thank you very much, Robert. Mr. Howard Tannenbaum. Thank you, Howard. Appointed to the board in 2001. It's 19 years. Served with distinction on a number of committees, boards, special board committees, and a very wise individual. So we're going to miss you, Howard. Lastly, Nick Torchetti, also a former Doctors Hospital board member and has also served for 25 years, has been instrumental in chairing a number of our boards, including the Eye Institute, and I've enjoyed working with you, Nick. So on behalf of the current board, on behalf of Jim, who would normally walk you through this, I want to thank you, the five of you, for your invaluable contributions to the organization. Okay, now on to our next part of the agenda. Many of you are probably wondering, okay, COVID-19, what happened, what's going on? Well, I will talk about it a little later, but I think the best way to showcase this is through a video. So have a look.
My experience working there has been really nothing less than extraordinary. I've never seen a group of care workers working harder. The cleaning staff, it's absolutely bananas, the extent to which they're cleaning. I mean, it's borderline comical, and I know it's not comical, but they are literally scrubbing the walls every single day.
Thank you everyone for joining us. We're here today to remember our 8 residents that died on 1 East. We remember their beautiful smiles, their gravitating auras, their unique personalities, and the stories that we now share that give us comfort.
want to support you. We're currently doing a calling campaign, but if you haven't heard from us yet, please know that we are in the office and give us a call. I am currently in process of creating a variety of videos, and we're going to be sending those videos out to you via email on a regular basis.
We have arrived at the clinic. Hi, how are you?
Good, how are you?
I have my bill of health. I passed the exam.
Come on in.
It's people's homes. People can celebrate their own diversity, their own sexual orientation.
I hope that our friends at Kensington Health have been well.
Yes, which is why we're here. We
Right.
are going to send through the medium of magic a message.
Virtual magic. Hi, everybody.
Hi, everyone. It's me again. It's John. Yep, I'm the president and CEO of Kensington Health, doing double duty, acting on behalf of Jim, the board chair, but now I am myself. And so just watching that video, I'm really touched by, first, the families. Many of you who are logged in today or will be watching the recording of this, the families, the residents, the patients, the clients. You've been with us throughout this journey from March until now. A lot has happened. Your support, your unwavering support has been instrumental in helping our staff, our teams support your loved ones. And so without your help, without your patience, without your understanding, we could have had a much different outcome. But your messages of support, our walls are covered with your notes of support. Many of you donated food, and it was all appreciated by our staff. So thank you. There is more to come in terms of this pandemic. I'll talk a little bit more about that in another section. But at this point, I also want to acknowledge the staff, the teams that are currently on this call, that you are all true frontline heroes. I know it's been overstated, but I will always view you as heroes. What you have done during the last couple of months has been unprecedented. Your commitment to patient care, resident care has been exceptional. And many of you on our ambulatory division who were furloughed early on, It was not easy for you. I know that. But I'm glad you're back. You're back working, supporting patients in our surgical suites. So welcome back. I also want to acknowledge the small cadre of volunteers and essential caregivers that have stepped up in this challenging time. You also have been invaluable in providing the care necessary to our residents. And so I just wanted to thank you, and that post-pandemic, we will celebrate your contributions properly. I do have 2 videos to show you. I mentioned earlier, we did lose 8 lives on 1 East North. One of those lives was a gentleman named Judy Searle. I had the opportunity when I was there at the height of the crisis to sit with Jim on a number of occasions and spend some quiet evenings with him. I'm not the best person to talk about that experience. We are so lucky to have Jim's wife, Judy, to share her experience with us. Right after Judy's video, we also have another video of Ana Celayeta, and she will talk about her experience on the front line. And like I said earlier, Ana represents the best of our staff, represents what happened and what is happening on each floor in the gardens. So let's have a look at these 2 stories.
Hi, my name's Ana Celayeta. I'm a PCA at Kensington Gardens. My rule of thumb is like take care of your residents like you would take care of your grandma or grandpa. So I try to do my best every day. So I've been working at Kensington Gardens for 3 years. When the pandemic started in March, I wasn't too worried about it. I was thinking, okay, this is gonna hit us, but not, we still have time. I wasn't too worried about it. It was different because I didn't know anybody on that floor. So I was working with new people and it was just, everything was unfamiliar. Of course I was scared because, you know, I was on a floor that was infected. Everybody was almost infected. And so now I was coming home to my grandmother who's 93 years old, and you know, she can catch it so very easily and I could spread it to her. That was my biggest fear. So, I mean, everything I touched, everything that I did, I was like, oh my God, I have to wipe right away, clean it. I was just scared that like by one little mistake that I forgot to wipe or something, that my grandma would catch it. So that was the most stressful part of that. It was an experience that we'll never forget. It was it's just very stressful when people were dying like an hour after, and it was just that, I think, was the most awful part of everything, is just seeing people die so fast. So yeah. COVID outbreak, it was a stressful time. It was long hours. It was high stress at all moments. The sun will always shine on the other side. Like, you can never lose hope. Because even when things seem that like it's not going to go well and like there's no hope, there's always a glimpse of hope somewhere. Like, you always got to think, okay, it's going to get better. I just want to say thank you for all the support you gave us, and thank you for the meals that you guys sent us that really like brightened up our day, made us something to look forward to. And thank you to my staff. They were all amazing. We all did hard work, and we all did the best we could. And that's all really you can ask for. And yeah, thank you.
Oh, hi. My name's Judy Searle, and I am from Toronto, and always have been, and I brought up my family here. It's been 6 months since he passed, and in some ways it's as though he's still here, because when we have family gatherings, there's grandpa jokes, you know, and this kind of stuff. So he's still with us, and it's, you know, as a happy memory, not as a sad memory. We were married for, oh golly, I have to add this up now. I think it's 46 years. And they were wonderful years. We had a perfect family. He was an architect, and he was born in Winnipeg, and he brought his practice here. My husband and I have a combined family of 7 children. We have 15 grandchildren. It was all about the kids, everything. He adored all of the 7 children. Helped to bring them up in to be responsible, contributing members of society. And he had a wonderful time with his grandchildren. Yeah, you know, he was able to joke with them and have fun with them, and he cared deeply for them, and they for him, yeah. Everybody here was so fantastic to him, and I don't know how they do it. They must be born with that empathy, that care, capability, you know, endless care. But the thing is, wherever Jim went, and I'm sure this is true of all the other residents, wherever he went, hi Jim, hi Jim. He's out walking along the street, and you know, anybody, not necessarily his nurse or his floor or his area. Hi, Jim. Well, how do they know this? And, you know, it just made him feel like a human being. How do they do it? I was so impressed and grateful. You know, you always think, it's not going to happen to me. It's not going to happen to Kensington. And Jim will be fine. They'll all be fine there. Then when the shutdown came, you realize you're scared stiff for everybody. It was unbearable. Because, as I said, he still had that spark. He was still expecting his people. and of course, did not have the mentality to understand where they'd gone and why. You know, where's my family? I was numb. I felt, well, here it is. Bad luck. This is terrible. This is bad luck. I hope I hope he doesn't suffer. But I thought, well, we never get to get near him again. And that just breaks you up. Yeah. But anyway, we get to the end and his final day. And the guys here know that my big fear, and Dr. Kaza knew it, and he almost promised me, you know, you can be there. I said, my biggest fear is I won't be there. So anyway, the Skype starts, and it took 3.5 hours for him to draw his last breath. And that darling staff guy sat on the edge of the bed, holding this thing up to Jim, the iPad up to Jim for 3.5 hours. I said, you know, this is, you know, I'm holding you from other work, other people. And he said, no, it's okay, I'm going off shift anyway now, so don't worry about it, I'll stay with you right to the end. What a gift. And he did. And I saw Jim's last breath. I was able to say, okay, you can go, it's okay, blah, blah, blah. And I saw him go, and it was a great gift. As things were getting bad here, health-wise for Jim, you know, couldn't get out of bed or whatever, and the COVID thing had happened and everything had shut down. So they made an arrangement with the family. Okay, if you come at a certain time, we'll take you into the courtyard, yeah. And we'll bring Jim. They wheeled him down in his bed all the way to that window in the dining room at a level with us. So we got the grandkids and everybody, and we were able to talk, a phone, staff phone outside, staff phone inside, you know, in his ear. And Jim wasn't talking, but he was aware and, you know, grunting, yeah, sort of thing. And you could tell that he was so pleased, you know. So one of the grandkids, he's a great hulking brute of a guy, he picked up the dog, whose name's Milo, held him up high, because Jim was lying down, he could only look up, and he said, "Here, Grandpa," and he waved Milo's paw at Grandpa, and Grandpa, who hadn't moved or anything, waved back to the dog, and he said, "I knew he'd come." Of course, we all broke down. Sorry. But you know, for the staff to do that, it was work for them. But you know, it's huge in a family. This place has a heart, and we were just lucky enough to be part of it.
Thank you. Thank you, Judy. So courageous for you to come and share your moments with Jim, Milo and Jim. I'm sure it wasn't easy to share your story with us, and I thank you deeply for doing that. Ana, thank you. I know you're back to your normal floor now. And you worked with a team of people that helped Jim and the other residents on the floor. And you really showed, as Judy said, the heart of the organization. So thank you. Ooh. I think we are going to a PowerPoint now. And as we do that, I should acknowledge the Searle family, who has made a very, very generous donation to the Emergency Response Fund. So thank you so much. Okay, not an easy transition to go from those two beautiful videos. That was our story of the pandemic. Many of you, the families who are on this community meeting, are probably wondering, what now? Now let's go to the next slide, please. We have been bombarded with negative media during the height in recent days about what this government is doing or should be doing to protect our seniors, to protect our residents. I want to say that the new infection rates in Toronto are increasing steadily. The community retransmission rates are also increasing. We're back to the same levels we were back in June in terms of new infections. And I want to commit to all the families who are on this meeting today is that our leadership team, Bill, Ana, Nicoletta, Nadine, and the entire Gardens staff have worked very hard during the summer to prepare. We continue to test our staff bi-weekly. It's no easy feat to get 350, 400 people tested every 2 weeks. Our quality team has done compliance audits on personal protective equipment and will continue to do so randomly every day, weekends, night shifts, over on our ambulatory division as well, to ensure that our staff are doffing, wearing the masks properly at all times. I want to give the families the confidence we do have enough personal protective equipment, which wasn't necessarily the case early on. The teams have done a fantastic job in procuring the required equipment to protect our staff. We are short on staff, like all homes across the province, across the country. Our leadership team has worked endlessly to hire new staff, new students, redeploying, if required, the corporate and ambulatory staff that happened earlier on. There are plans that have been made that are ready to be executed in the event there is a wave 2, a significant wave 2. So I just wanted to say that right up front, as many of you may be wondering. Next slide, please. So I'm going to shift a bit from COVID and talk about 4 areas of focus for Kensington in the upcoming year. And a lot of this work has been done during the pandemic. And when we come out of the pandemic, I know our organization will be a lot stronger. Next slide, please. Okay, partnerships. Now, the partnerships, we have a number of partnerships with our hospitals in ophthalmology, anesthesia, and palliative care. We also have a number of partnerships, academic partnerships with our colleges and universities. And so partnerships is an integral piece of what Kensington is and how Kensington provides the care. So I'm just going to talk about a couple of unique areas. Next slide, please. First is our partnership with Women's College Hospital. They have been phenomenal pre-COVID in our partnership that's called Long-Term Care Plus, which gives us expedited access to specialist care for the residents. So instead of going to the emergency room, our clinicians can access specialty care at Women's College. That relationship really bore fruit during the pandemic, where they helped secure personal protective equipment, provide infection prevention and control, as well as about 17 staff members from all parts of Women's College helped to shore up the floors during the pandemic. We are so thankful for their support. We continue this partnership through the mobile testing, and post-pandemic, we will continue to deepen and enhance our relationship. Next slide, please. This looks like a complicated slide. It's not meant to be, but what this shows is the surgical volume in our healthcare system today. And so on the far left, in March, there were 0 elective surgical cases being done. And as of June 13th, the backlog is 148,000 procedures. And that's projected to take 84 weeks to clear, so 18 months or so. Now, where we benefited from Women's College as a recipient of a partner, we're also playing the opposite role, where we can support our hospital partners in serving as a pressure valve for elective procedures such as cataracts, colonoscopies, retina procedures, and so on. Now, there are ongoing discussions with the University Avenue hospitals to facilitate a unique way of delivering a hospital-based program in a non-hospital environment. So to the Kensington Eye Institute, the Kensington Screening Clinic, Diagnostic Imaging, and the Eye Bank, you are a key component of helping the system recover. And we are happy to partner with our hospitals to do so. Next slide. This isn't a technical glitch, it's a black slide, and it's really to acknowledge our emphasis and focus on anti-racism. For our Black and Indigenous colleagues, we feel we have much more work to be done. We feel that we just don't know enough yet. And so in short order, we will be collecting data, not just another survey, but really to understand what the systematic barriers are within Kensington, how to address them, how you're perceived, and what needs to be done. We're also going to start with our board of directors, anti-racism education. And so we will do this from the ground up and from the top down and meet in the middle to make in Kensington diverse, inclusive, and to be an equitable employer to our Black and Indigenous colleagues. Next slide, please. Ontario Health Team is a major focus. Kensington Health is a neutral convener of a number of organizations in the Midwest Toronto area, which is west of Yonge Street, south of St. Clair, west of Roncesvalles, and then the lake. So it's a fairly large geographic area, roughly 500,000 residents in that area. Next slide, please. And the role of the Ontario Health Team is to design a new system of care that makes it easier for people to navigate the system, whether it be through primary care, home care, community care, hospital care, long-term care. We don't operate as a system today. And this initiative is to help address some of those transitions. As of last week, we have submitted to become an Ontario Health Team, and we hope to share some good news later in the fall as an official Ontario Health team. Next slide. And we hope to do that with 51 partners from all sectors, including our 4 downtown academic quaternary care hospitals, as well as a number of community organizations, primary care organizations, community organizations to facilitate this care. Some of you are on this call today, and to those partners, thank you. This is the easy piece. The hard work is about to start. Next slide, please. The third area of focus, you might have noticed this special K, this big K. We have spent the last year rebranding in partnership with the Kensington Health Foundation. Next slide. This is more than a change in visual identity. It's not about the logo. It is about how we talk about us, how we communicate about Kensington, what we value, what we feel is important. And our mantra is about giving new meaning to community care. And this is based on a belief that there are always new ways to improve care, to improve community well-being, if we have the passion and compassion to find them. And I think we do. I really think we do. And so we will continue to strive to fulfill that mantra. Next slide, please. And so with a new brand creed, a brand positioning, with the help of our partners, Conflict, we have developed a new visual identity, which really encompasses 3 things. It is the cultural fabric that Kensington has, and you heard some of that earlier. The big K that's noted for our current logo and representative of Kensington. And then where we are in terms of place and geography in the heart of Kensington Market, a cornerstone in the city. And together, those 3 things form the different pieces to the K and represents the colors as well. And that is our new logo. We will be rolling this out, as shown in the video, first on our website and more softly with some standardized communication. So you'll see a little bit more of this logo in the future. Next slide, please. We've also updated our values. So the first 3, excellence, respect, and teamwork, have been values of the organization since its inception. We talk about it slightly differently, and it really showcased itself during the pandemic. The 4th one, action, is a new one. And I quite like this value because that is exactly how it describes what Kensington is and how we behave. We are an organization that's dynamic. We are constantly in motion, trying to improve. Our staff roll up their sleeves to serve. And that action is a key part of who we are. Okay. The 4th element. Is there another slide? Yep. Is our hospice expansion. But I'm not going to talk about it because you've heard from me enough. Instead, I'm going to flip to a video where our Vice President of Residential and Community Care, Bill O'Neill, or Bob the Builder, will show us the hospice expansion. Video, please.
Hi, I guess some of you realize I'm standing outside at 38 Major, our wonderful hospice in our historic chapel. Built in 1888, by the way, by the Sisters of St. John the Divine. We did open the hospice here in 2011, and since 2011, I think we've served almost 1,000 people and their families in providing excellent end-of-life care for the community. Some of you may know, but I have some really exciting news for everybody. We are expanding this hospice. As I said before, this is the only residential hospice in downtown Toronto. We only have 10 beds, and we're almost doubling our capacity to 19. We don't have space in this building, so we're moving next door to 45 Brunswick. I've got good news for you also, more good news. You can see I have my hard hat here. We're going to walk next door, and I'm going to show you how we're coming along in our construction. So let's head over to 45 Brunswick and have a look. So here we are just outside 45 Brunswick Avenue. This is the site of the new residential hospice. And right behind me, we're going to have our wonderful therapeutic garden where family and residents can sit and reflect, build new relationships, talk about old relationships, and really connect. One of the great things about the new building, we're designing huge garden windows. It gives an opportunity for the outdoors to come in and the indoors to enjoy the outdoors. When people look out their windows on this side, they can see wonderful historic Brunswick Avenue. There's wonderful old houses that really feel part of the community. So I'm really excited now to take you guys inside and show you what the new space is like. But don't get too excited. It's pretty rough right now, but you have to envision what it's going to be like. So let's go in and have a look. Well, as you can see, this is an enormous space that the additional 9 new beds are going to be located, and it's just a massive space. You can see all sorts of different, all the walls are gone, if those who knew the space in the first place, a big transformation. Where I'm standing right now is sort of the entrance of the residential piece of the hospice, and on this side we'll have 9 residential bedrooms with washrooms on this side, and on this side here we'll have some nursing activities, community room, family kitchen, spa room. I should say that each resident room is going to have a big garden window overlooking what we call our living garden wall. It's going to be beautiful. We're really looking forward to it. So as I talked about this enormous space, it allows us to also do other activities within the space. We started to operate a wonderful day hospice at 45 Brunswick until the COVID hit, and we had to shut it down. We're going to be starting it back up in this location. It'll give an opportunity for people living with life-limiting illnesses in the community to come in, spend a day, speak to other folks who are going through the same issues, speak to a physician, a social worker, a counselor, possibly have a bath, and have a day at the spa. Certainly we'll give them a nice meal, a chance to really connect with people, and also give family members a chance to sort of have a bit of a break. The day hospice is also a feed into what we call our respite care for people who need 1 or 2 weeks of residential care when they can come in, regroup, and then go back home. So we're really looking forward to this whole thing about servicing the community at a much larger basis. Our hospice expansion is the next exciting step in the history of Kensington. We also believe that it's important to provide good endings for people at end of life. We do that best here at Kensington. I'd like to thank you for coming on this trip with me today.
Hi everyone, I'm Corinne Rustretz. I'm the CEO of the Kensington Health Foundation. Welcome to our virtual discussion about the hospice. I would love to be able to lead you through it, but we are, as you know, currently in a very interesting moment. And so as part of our new normal, we're going to take you on a different kind of virtual tour, and I'll tell you a little bit about it. And now let's see our creative, please. Thank you. So many of you come to us from lots of different places. We'll have the next slide, and you'll learn more about Kensington Hospice. As Bill said in his wonderful video, the hospice started in 2011, and for the past 10 years, we've served over 1,000 residents. We built it without any form of government funding. And our commitment was very strong at the very beginning from an advocacy standpoint. We knew that it was important to give those with terminal illness and their loved ones a better choice for end-of-life care that was in the community, close to home, where they could get the supports they need and not be in a hospital. Since then, in addition to serving all of those residents, we continue to serve their families. Hospice offers holistic care that includes at Kensington year-long bereavement support, and we help to keep hospitals free from other patients so that we're flattening the curves. We're flattening the curve. So hospice care is really an essential part of the entire healthcare system. But we only have 10 beds. And so normally what I would do is I would actually show you what the hospice looked like and be able to share more about it. So for now, I'm going to share a little bit about how we plan in a pandemic. Next slide, please. So this is actually a piece of creative that comes from our case for support. And it talks a little bit about how we play such an important part in the healthcare system. What I think I'll do is I'll just flip through some of the slides quickly, and I'll be able to share more with you about some of the pieces that we're developing, and we hope that we'll be able to share with you very soon. Okay, next slide. So clearly planning a capital campaign during a pandemic is not very much fun. Next, please. And so what we've decided to do is we're actually doing a virtual campaign. We want to tell you about the entire hospice experience without actually giving it to you in person. And so in order for us to do that, we've actually developed a whole new series of things that include print material, an expansion, a brand new website that you're going to see, architectural renderings, including a digital version that actually looks like Minecraft, where you'll actually be able to go through the entire hospice, and a 5-part video series that are all coming soon. Next, please. And I just have a couple images to share with you. This is what the main square and living room will look like. Next. You have elements of the case that actually show some of the details. Next. In addition to that, this is the campaign website. You'll be able to actually visit and do a virtual tour, including each of the rooms. Next. And this rendering, this digital rendering, actually shows what the hospice will look like from a bird's eye view. And the next time we meet again, we'll be able to show you a video that actually takes you through this space. Next. Thank you so much. It's been a real pleasure to get to introduce this to you. It's a very important part of the Kensington Health family, and I want to thank you all for the support that you offer us in so many different ways. Back to you, John.
Okay, thank you everyone. It's 2:03. I recognize we're a couple minutes over. So thanks to all the speakers. Thanks for all of you for joining.